أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيد الأنبياء والمرسلين سيدنا محمد اللهم صل وسلم وبارك عليه. All praise be to Allah, the only God, the one God, the creator of all and the owner of life. And peace and blessing upon Moses, peace and blessing upon Jesus, and peace and blessing upon the final Prophet Muhammad, the mercy to mankind. My dear brother, my dear sister, my dear viewer, Assalamu alaikum wa rahmatullahi wa barakatuh. Yesterday, 1st December, World AIDS Day. I was planning to talk about it today and to show how from the Islamic Holy Scripture, if you behave according to the teaching of Islam, you will avoid more than 95% of HIV and AIDS infection. But, I'm sorry, I'm unable to do the subject today as I was planning to do it. Because I was busy on Friday and Saturday, 2 days ago, 3 days ago, with two big pro-life conference. Pro-life. A lot of Muslims do not know the word pro-life. Pro-life means sanctity of life. Mean no killing of unborn baby, janine, fetus, no abortion. It means no killing of all people, disabled people, chronic sick people, no assisted suicide, no euthanasia. So this very common term, I mentioned it to you before, used by non-Muslim, by Christian, by people in the West, when they say pro-life, mean sanctity of life, as it is in Islam. No killing of unborn baby, no abortion, no euthanasia or assisted suicide. On Friday, 29 November, I attended the first conference all afternoon in the Royal Society of Medicine. And it was organized by this great organization, Christian multi-faith. The beauty about it, multi-faith. Muslim, Christian, and other. Medical Ethics Alliance. They organized a seminar or the conference, and the title, Mental Health Reason for Abortion. Are there any mental health reason? Not many people know that a lot of abortion done today, extra and extra under the name, she feels depressed, I'm not well mentally, I might feel suicidal, etc. Quickly, 2 doctors sign, go for abortion. Abuse, misuse, and is used widely. I'm glad Medical Ethics Alliance and the chairman, Dr. Tony, and who organized this beautiful, unique conference, because I haven't seen before anything like this, related to this fallacy. You have to do abortion for her, otherwise she becomes mentally ill, disturbed, suicidal. A big fallacy. And unfortunately, in the trap, doctor fell. Unfortunately. There were 4 speakers, one of them, good friend of mine, Muslim, Dr. Jafar Qureshi. The first speaker, John Duddington, barrister, editor of law. Law, this is one side of the story. You need to address it from medical, psychological, legal, religious, etc. He gave a good talk about what are the legal grounds for abortion, What are not legal grounds for abortion? Beautiful legal illustration. Legal illustration. The second talk, which I like it very much, Dr. Greg Gardner, tutor in general practice, University of Birmingham. GP, tutor to general practitioner. Title of his talk, Risk, Consent, Evidence, and Denial. Is abortion provision good medicine? Is it good medicine? A general practitioner view. Then there was psychologist, Dr. Michael Scott. He talked he gave psychologist view, honesty, reverence, and the abortion debate. And finally, there was my colleague, Dr. Jafar Qureshi, former chairman, Health and Medical Committee, Muslim Council, Britain, trustee, Muslim Doctor and Dentist Association, and consultant psychiatrist in Birmingham, Dr. Jafar Qureshi. He gave a psychiatrist view. Obviously, this subject, this conference is close to my heart because I'm qualified psychiatrist also. I used to be practicing many years back. I had early retirement. Many years back, I used to practice psychiatrist in many hospitals, general and psychiatric hospital here in Britain. The subject is very long. We have about 4 or 5 hour talk and session. I'm going just to give a very important brief related to the issue, main issue, general issue, mental health, if connected to abortion. As I said before, doctor, I want abortion, I feel unhappy, I feel depressed, I might kill myself. Doctor, quickly. 1, 2, doctor, sign. Go and kill your baby. And suffer after, you woman. Not many women know that. Suffer was mainly psychology. He doesn't say that. He doesn't want to know about that. He's in denial, the doctor. Suffer psychological, mental illness. The opposite, what they talking about. Do abortion to avoid mental illness. They will suffer. We will mention soon clearly, you suffer. After that, you can have breast cancer. Some women. The problem are many today. Thank God to science and study and investigation. Let me give you a few major points related to this conference talk there and give you a bit of my personal opinion as a Muslim doctor, ex-doctor, psychiatrist, ex-psychiatrist. But first, let's remember, every day in Britain, Muslim, where are you? Every day in Britain, 600 babies are massacred, killed in abortion every day. 200,000 a year. Every day. 200,000 a year. Under the name women's rights, law legal since 1967 to kill your baby up to 24 months. 6 months, he can be born alive, stay alive. And up to 9 months. You got feasible. 9 months, the baby 1 minute will be born. You kill the baby if there is disability, handicap, etc. So cruel, so inhumane, so uncivilized, so un-Christian and un-Islamic. In the law on abortion, there is one 1967 when it started to be legal to kill, like we have now up to 6 months, 24 weeks. This thing called Clause C. This is related to the title of the conference. Clause C, when there are some sign, indication, statement mental illness, she will suffer mentally if she carry on with pregnancy. This is the heart of the subject. Close C. And doctor today rushing all over Britain to sign. And one thing I learned in this I didn't know that. You don't have to see the patient. Unbelievable. Sign. Sign for abortion, doctor. Sign to kill. This doctor who take oath before took oath not to kill, but to protect and save life, all his life or her life. They're doing the opposite, as I said, schizophrenic. And wait one day, I say it and I mean it as a qualified psychiatrist. Wait one day when they discover the hidden mental illness among doctors who do the butchery, the killing, the cutting of a living human being with a soul in most of the almost all the time, soul and ruh. We today, I don't know how many doctors are aware of that. In the normal practice, when women go for abortion, we have got well-known syndrome, post-abortion syndrome, post-traumatic stress disorder, caused mainly by guilt, severe guilt feeling. Guilt. When she does abortion, how can she betray her instinct, motherhood, to kill her own baby, flesh and blood? How can she do that? So it's a lot of report and study and medical investigation, etc. Women suffer. A lot of them, I cannot say 100%, all of them, or early, sometimes it comes late, they suffer. Many rising number of women. Mental illness, they don't have mental health. They have anxiety, they have depression, they have stress, they cannot sleep. They feel depressed. They feel suicidal. They go to drug. They go to alcohol. Because of abortion. In the law, we do abortion to avoid mental illness. Look, this paradox. Unbelievable. This is well known. We know that for a long time. Post-abortion syndrome, anxiety, depression, based mainly on the guilt, hidden guilt. Sometimes it doesn't show, or in denial. The woman stay maybe even for a year, denial. But there's something traumatic inside. And woman, not man, so strongly have got attachment to her baby. So strongly, motherhood instinct. So the trauma is more severe than the man. More severe to kill your baby, to kill your own flesh and blood. Post-abortion syndrome. And when we go back to this issue of mental illness, do abortion, otherwise she will be depressed, not well. In many cases, I wanted to raise this in the conference, in fact, on Friday. I didn't have a chance. Woman sad, unhappy, mildly depressed. There is no clear clinical depression, even no clear mental illness. One thing it was raised, there is no scientific accuracy, assessment of this woman is she really going to be, she's mentally ill now, or is she really going to be suicidal, etc. It's mixed, it's difficult, it's a gray line sometimes. You know, even women or men, you know, you can pretend, create a lot of symptoms and go to doctor and psychiatrist if they want to get rid, if they want to get rid of her baby. You know, I mentioned in other conference, I regret, I used to work psychiatrist, working with mental psychiatric disorder patient in hospital, psychiatric hospital. I regret one thing. I never ask a woman depressed coming to my clinic or is in hospital. I never ask her, did you have abortion before? Is missing this question, by the way, among even a lot of psychiatrists today. If she's suffering from anxiety, overdose, suicide, alcoholic, drugs, have you asked if she had abortion? We don't ask. Unfortunately. I regret I never asked. And this will give you clarity when you know the link. Sometimes we have reactive depression, link to this traumatic incident in her life to kill her own baby. Many medical studies, and I think this Dr. Greg Gardner, he illustrated beautifully about many studies proving the opposite with many graph, comparison, and many countries. The rate of mental illness after abortion higher than the rate of any mental illness if the woman carry on with pregnancy and have baby. So many graphs showing all the time higher. In many studies, I was not aware of that, even me myself. This is a great ammunition. I wish we utilize and publicize this study, because they all brainwashed, almost all doctors. Do abortion, she will be mentally ill, depressed. The real scientific medical study higher rate of mental illness after abortion, much more than if the woman has given birth and carry on with pregnancy. What more do you want? Evidence. I know one doctor raised the issue. There are also maybe other studies saying the opposite. But at least it's controversial, at least should be open for debate and more research. But the other problem is research. Not many people know that, and I did not know that. There is no national health NHS number when you do organized abortion. How can I do the research and study? Is this a cover-up? Is this a conspiracy? I don't know. We cannot compare and look and study the patient. There is no number. This opened my eye in this conference. I did not know that. Show you the weakness of so-called diagnosis, mental illness, do abortion. Weakness. And we need it for research and study, as I said before. And doctor does not see the woman, as I mentioned before. She does not have to see the pregnant woman to diagnose, decide about mental illness. Where are the doctors? Where are the psychiatrists? Where are the Muslim doctors to scream, to speak up? How can you do that? It's a life and death, a whole human being to be killed, tortured before killing, before dying, and to give the woman suffering after from abortion. No informed consent. It was raised. Informed consent is missing. By the way, is more missing among our own Muslim community when they see doctor. When they go to hospital, we don't ask. Doctor don't bother to explain how the procedure is done. Wallahi, if people see the barbaric way of killing unborn baby, they will stop. If they have got a little sense, they will stop doing abortion. How is done? The barbaric, cruel, painful, bloody way of cutting the baby to pieces, 20 pieces, 30 pieces. Informed consent to show the woman. I always like to do this project in my mind. I raised it before to have like a cube in the center, city center, in many cities. Would you like to see your baby? 3D scan. Any pregnant woman, free. We don't want anything. Just, we like you to see your baby. Wallahi, if many women see their baby before they commit the act of abortion, they go for abortion, many will change their mind. Humanity of the baby, the organ of the baby, the heart, the beating heart, the brain, the finger, the toes, the kidney, the liver, the eye, the nose. We need this to go badly to every girl in our school today. To show them the embryology, and we have got fascinating thing in Islam, Islamic embryology, fitting with all medical science. To show them, they don't see. They only know from the media, blob of cell, few cell, that's all. They don't know. From about 6 weeks to something, fully human being almost. All organ. 2 weeks, 6 weeks, 42 days. And this is a crucial time the soul is breathed in. No informed consent, no information about complication, side effect, about mental illness, post-traumatic stress syndrome. Nobody will mention it. And all these family planning clinic, they don't give this informed consent. They don't show her the problem, the cruelty of abortion, To be aware of complication before you decide, I might have breast cancer. You might have breast cancer. You might become mentally ill. The opposite what they're saying. Mentally ill. How many people know that? How many women went for abortion did have all this basic information? I doubt it. I doubt if there is maybe 1%. I don't know. Informed consent is very much needed for Muslims. They go to a lot of clinic procedure. They don't hear from them. They don't explain. Sometimes we have a little weakness, language problem, etc. I believe for every pregnant woman considering abortion, whatever she is, if she is Muslim, first she has to know the Islamic holy scripture on the embryo, fetus, unborn baby, on abortion. Sacrosanct. The whole holy book, Al-Quran, our holy book, final holy book to mankind, the whole 20 volume of saying of the final Prophet Muhammad, peace be upon him. There is no single line, statement you can do abortion. We have a lot of statements, do not kill in the Quran, you pay blood money, punishment, etc. Statement, life from fertilization, you're not allowed to disturb the fertilized egg from first day, first moment of conception, informed consent. What I would like to suggest, whether for this issue of mental illness, mental health, or generally, any woman thinking of abortion, if she is Muslim, please, sister, phone me day and night. Look to my website, SPAC website. Look to many websites, pro-life, who have got information about the unborn baby, humanity of the baby, complication of abortion, cruelty, how it's done, complication. Please. This is part of the informed consent. It's not done today. So please do it. Any woman or Muslim woman, you should know. It's a big thing, my dear sister, killing your own flesh and blood. And you're paying price. Many women do not know. They're suffering too. We have 2 victims. One lost life, the other one suffering. Mentally, psychologically, and physically during their life. Obviously, I cannot say all of them, but we have rising percentage. Counseling is very much needed. Any woman considering abortion. Why you want to kill your baby? A nice, wise, gentle counseling. Not based on judgment, on morality, even on religion. Counseling, not based on all that. Why? Try to be with her. You are a human being, she's a human being. Find out why. And how can we deal with the problem? Is it financial problem? We can help today. Christian can help, Muslim can help. Is it accommodation problem? Can help. Obviously, unfortunately, most of the amount of abortion because of adultery, fornication, unwanted pregnancy. No marriage. It's more complicated now. No marriage, no man, no father, no husband. This is why I always say to clear 2/3 of 600 baby a day, propagate chastity. Basic in the 10 Commandments. in Judaism, in Christianity, and in Islam. To avoid 2/3, 400 to take out. But now, sexual immorality, promiscuity, even young daughter in school, so many programs reported in the last few days, shocking, about this sexual immorality and sex among girl and boy in school, age, etc. Informed consent, she has to know. Family support, I like to raise it. Nobody talk about it. We are with you, my daughter. We know maybe it's too much, maybe mistake done, we are a human being, adultery, we support you. This is very difficult to find among Muslims. And they should be doing family support. We are a human being. Obviously, Islam, if she outside in marriage, it's easy, you cannot do that. But outside marriage, and you try to help. And one of the way in Islam, marry each other. The man, she's in love with the man, with the boy, marry each other. And give some legitimacy to this child, although any child born outside marriage in Islam is legitimate. Even is called illegitimate, And sort out the problem, if there is any. Give her some alternative, adoption, other way to take care of her child, of her pregnancy, etc. And as I said, if Muslim woman, tell her about the prohibition, forbidden, haram, you cannot do that, etc. And seeing her baby, I love this to be done, automatic, free of charge. A few years ago, I raised it. I wrote to many Christian leaders, pro-life. I said, I'm ready to pay the £1,000. First payment, then get the rest from your community, or maybe I do more among my community, to buy this 3D scan, which is expensive, to show every pregnant woman free of charge. We can put it in a church, in a mosque, we can put it in city center. Come on and see, And this is the second time I raise it, by the way. I'm not going to raise it anymore. Third time, no more. I'll change my mind. I said, I'm ready to put £1,000 as a donation first to have this 3D scan, to allow pregnant women to see. No talk, no judgment. No do that, no don't do that. Give a leaflet, show her the organ, photo, etc. Alternative, seeing her body 3D scan and show her the baby is a human being, all organ. And today we are lucky, we have medical technology and scan, we can see a lot today. The baby, we are lucky. Show her how the baby is killed. They run out. Nobody would like to discuss it anywhere. How is killed? The cruelty, the barbaric, the cutting to pieces. And explain side effects and late complication, etc. from abortion and post-traumatic, And by the way, I like to raise, where is the father? There could be a man attached to the woman, pregnant. He like her, he want to carry on with her. He might develop mental illness. He lost his child without his permission. She done it without his permission. There should be two decisions. Two people to decide, not one. Especially if they have some stable, continuous relationship, or marriage especially, And as I said, we have usually two victims. I think we should educate every girl in school about pregnancy, about the embryology, about motherhood, about breastfeeding, about responsibility, about duty, etc. This is lacking in parental skill, etc. And legally, it's a big problem. It's legal, it's halal, it's normal to do abortion. It's accepted. We need to address that also. The law should be changed, ideally, And the woman should maybe suffering more mental illness, as I said, after abortion. Large waste of medical resource and betrayal. Doctor betrayed. They should be punished. They took oath, Hippocratic oath, or Hippocratic now, to protect, to save life, to relieve suffering, not to create suffering and not to create killing. If I have my own way, every doctor not pro-life out from the profession. I know it's too strong, I'm saying. Out from medical profession, you know. And finally, I was happy hearing Dr. Jafar Qureshi mentioning about the plan to work among psychiatrists, because they abuse this issue of mental illness. It's not done on research, on study, it's not done properly by two qualified psychiatrists seeing the patient. And you know, as he mentioned, Dr. Qureshi, we sit 1 hour at least to get history. And we sit more. When I used to practice, I see the relative 2-3 hours to find out about the background, etc. Today, fast track, everything fast, you know. So I thought this is relevant, and I wanted to raise it because I am worried about my own Muslim community, especially, and it's important to be aware of this fallacy. You're going to be mental. I'm not saying it's definitely no one. There could be some, obviously, no doubt, but not like all this case going sign abortion is done wrongly. Now the second pro-life conference was on Saturday, and this conference I had my talk, alhamdulillah. Another subject, unknown even to many Muslim doctors, unknown to Muslim nurses, unknown to Muslim patients, and very worrying, my dear Muslim viewer. There's something done, beautiful title, Liverpool Care Pathway. And it's a guide to nurse, doctor, when you have old patient, chronic sick patient, might die soon, demented, confused. This is a step. Tick, tick, tick. You do that. Tick, tick, tick. And you know what we discover at the end of the day? Killing the patient. This is what we discover. This is why, thank God, a month ago or something, 2 months ago, they said we're going to phase it down and to stop it. Called Liverpool Care Pathway. It's short way to killing. Attractive on the term. They discover scandal after scandal. Relative waking up. My dad, my mom, killed. What happened? They done nothing wrong. And this beautiful conference organized by Teresa Lynch, academic nurse, strong pro-life campaigner, especially against euthanasia, and done in the University of Westminster on Saturday. Liverpool Care Pathway, Ending Not Mending. Ending Not Mending. Beautiful title. Last Saturday. And there was talk by her, Teresa Lynch, patient advocacy. Then we had a son, relative experience of Liverpool Care Pathway. Then we have a doctor, I was happy to meet him, Professor Sam Ahmad Zai, symptom control, the doctor role as patient advocate. Then we had another lady talking about the killing of her mother in hospital, Liverpool Care Pathway review finding, Mrs. Denise Charlesworth. And my talk was the last, Liverpool Care Pathway, a Muslim response. Unfortunately, time is running out. I'm going to give you a very brief viewpoint. Ideally, I need 1 hour to go into this subject. Now, this Liverpool Care Pathway, as I said, is misleading today and is used to kill patients by different technique and by different way. The main thing about it, as I said, they have like a guide since about 10 years. Liverpool Care Pathway, you tick, you see. The dangerous thing in it, you are allowed to stop food fluid from the patient. You kill the patient by dehydration or starvation. Many are killed. By the way, today, in the newspaper and in Daily Mail, 2 old people killed every week by dehydration. They have this crazy idea, stopping stopping food and fluid. Is a human right, is an Islamic right, is a medical right to give food and fluid all the time when you are healthy, when you are sick. This is one of the ways to kill the patient. Another way, they have this fallacy, wrong assumption. Patient is going to die. Prognosis. They know for sure. I know we know sometime, but not for sure. Not 100%. This is another serious thing. Fallacy. Wrong idea. Leading to killing. He's dying. Don't give any help. Don't give any medicine. Don't give anything. He's not dying. He might look dying. She might look dying. But when really the patient is dying, we cannot do anything. We have to admit. Finish. He's going to die. You know. But a lot of case, misnomer, you cannot be. Only God, the Creator, know for sure when the patient is dying. You know, we have a lot of story today. Scandal after scandal. Doctor said she's going to die. She's alive for a year. Doctor said the baby will not survive only a few days ago. The mother in Daily Mail, the doctor said should do abortion. She refused to listen to this killer. She kept the baby alive, brought the baby, showing the baby to all people in the world. So this different idea, and we discovered scandal of finance, Target, hospital, bed, we need the bed. There are a lot of things going on in the background, my dear British public. The whole system, national health, need to be reviewed. Big U-turn, what's going on. Directly, indirectly, killing patient, ending the life of the patient. I'm bringing this subject also because I'm worried. I mentioned in the conference, I'm worried there will be more Muslims killed because of language problem, difficult to communicate, and they don't ask the Muslim patient or relative, like other people may be asking non-Muslim, and doctor do not explain to them, etc. So my dear brothers and sisters, please be aware. There is a killing machine, legal, still going on for months. If your mom and dad, your granddad, your grandmom, if you discover died, they said died. As one lady said in this conference, in the death certificate you should put cause of death, Liverpool Care Pathway. You should put that. This is the cause of death. Is heading taken out. And I appeal in the conference about nurse and the role of nurse to be pro-life, angel of mercy, to be our eye, our ear in hospital, to protect our patient, whatever their religion or color or race. Obviously, I raised in my talk, if anybody interested can leave email or phone, they will give my email, studio here, and I will send if anybody interested. I raise the issue of God, owner of life, created life, he started life, finished life, sanctity of life, no doctor, no nurse, no patient, no family, no judge, no member of parliament have got the right to decide about ending life of any patient. No one. You just, as I said in my talk there, you do your best and you leave to God the rest. Should be the way. And finally, I feel we have a big issue to educate public by and large, and relative and parent and all the about this scandal of hidden killing in hospital. You take your beloved one to be treated, to be alive. My God, you're going to find him dead or find her dead, your grandmom, your granddad, especially if they are with Alzheimer, with dementia, with confusion, lack of concentration, no food, no fluid. Stop medicine. My God, unbelievable. And doctor colliding. What are they doing? Doctor colliding with this criminal act. You know, we need a massive, big campaign to educate our Muslim community, to educate the public, to educate the doctor. We need to raise campaign among doctors. Inshallah, we'll be sending this beautiful talk, Dr. Gardner, Greg Gardner, about this study. As I mentioned before, fallacy of mental illness, to make people aware what's going on. I know it's different subject, but we need to spread message and education, you know, about this issue. Need more control, need more God-fearing. We badly need a pro-life doctor. We badly need pro-life nurse. May Allah guide me and guide you. And thank you for watching. Wassalamu alaikum wa rahmatullahi wa barakatuh.